So what did they tell us then, Richard?
Yes, Colette, well, assaults on frontline healthcare staff have become an unwelcome but well-established trend in Irish hospitals and surgeries over the last number of years. And these figures, acquired by the Sinn Féin health spokesperson David Cullinane and first published in the Irish Times, really lay bare the volume of assaults, both verbal, physical and sexual, which take place against our healthcare workers on a daily basis. Over 12 on average over the last 19 months, assaults on healthcare workers, more than 7,300 in total from January of 2021 until July of this year. Nurses make up by far the most frequent targets of these, over 4,400 or 60% of all assaults on health staff. David Cullinane has said that this is something which cannot be allowed to continue and has called for urgent action to make sure that it is eradicated due to the ongoing overcrowding situation, which he says is a leading factor in it.
We have to take a zero tolerance approach. We cannot accept assaults on frontline healthcare workers. Obviously we have to deal with the capacity issues in our emergency department, and the Minister has said that he wants to present a plan. He still hasn't done so, but I think part of that plan has to be also how do we protect those on the front line. Obviously additional security in hospitals has to be looked at, but I think all those other issues around occupational supports and dealing with the overcrowding are all part of the solution to ensure that we dramatically reduce these assaults.
Well, the country's main nursing union, the INMO, says there needs to be a zero tolerance approach now towards assaults on healthcare staff. This has been highlighted before as one of the issues which leads to a problem with retaining nurses in our health sector, many of them leaving to other countries, whether it be the UK, Australia or further afield, due to working conditions as well as their pay and conditions too as well. Now, it has been stressed that there is also more of an issue due to the ongoing overcrowding situation, which has started earlier this year. It has happened over the summer months. You have about 440 people admitted to hospital today who are waiting for a bed. And when you combine that with the situation where the HSE's National Ambulance Service is already under huge pressure as well, you have the ongoing junior doctors industrial dispute with the prospect of strike action there is a real fear that this could be a very, very difficult winter indeed for the health service. It is also worth mentioning, Colette, that the HSE CEO Paul Reid, who has previously announced his intention to step away from the job at the end of 2022. He has today confirmed he will be leaving the post on the 3rd of October. After that point, he will be on annual leave until the end of the year.